Welcome to Mystery of the Soul. I'm your co-host Erin, and I'm joined by my friend Leo, a psychic medium and Reiki master. Our podcast explores the depth of the soul, the spiritual, and the supernatural.
Hi guys, we're back. Welcome back.
Hi Leo.
Hey Erin.
How are you?
So we have a guest here today, Jen Dibennedetto. I was introduced to her by a mutual friend. Jen is a Reiki research professional with the International Center for Reiki Training. She's also a nurse practitioner, and she's going to share a little bit about her work with Reiki, what Reiki is, and how maybe she got involved with Reiki research and how she implements Reiki in her day-to-day profession and practice.
Hi Jen, it's so nice to meet you.
Yes, thank you for having me on. It's such a pleasure to be here.
Oh, I'm so excited. This is going to be such a good topic. Reiki. Leo and I have talked about Reiki before on previous episodes, but we've never had the pleasure of sitting down with someone like you who's done Reiki research. So we're really excited about that. Jen, why don't we just start while you tell us a little bit about yourself, like who you are, what got you into Reiki, what got you to where you are today?
Yeah, and actually I have a pretty interesting history in terms of how Reiki really found me. And I say that because I find that when you are really involved in the Reiki community, it's very rare that somebody just really seeks it out. I find it always just finds you.
Mm-hmm.
And how it happened to me was actually I was about 19 or 20 years old. And at the time I was a nursing student. And I was just navigating one of my first clinical rotations, and I had a patient who had a total knee replacement. And he told me he was a Reiki master. And at the time, I was like, this is very interesting. Like, I have never heard of this. So, as a student, you kind of get to just know your patient. And this was my patient, right? So I was just like, yeah, let's talk. Let's get to know each other. And I started learning more and more. And then I felt something inside me say, this is what I have to do. And then I went to my little clinical group. And at that time, I was like, I think I'm going to do Reiki. I'm going to be a Reiki master, just like my patient. And they're all like, okay, like kind of weird, but okay. And I was like, well, it just really resonated with me. So to make a long story short, I ended up about 3 years later, because it's just always hung out in the back of my mind. I took a holistic nursing class as part of the curriculum to get your bachelor's of science in nursing. And at the time, I met my Reiki master who attuned me there because she ended up doing a lecture on Reiki, and I did a paper on it as part of course credit. And at the time, I was like, this is it. It came back again. This is it. And ever since, it's just been something I loved to receive. And then I started going through attunements. And ultimately, when I started getting into Reiki research, it was when I was in my master's degree program and I was getting more familiar with how to read articles. And I was like, there's got to be something on Reiki because it's really helped me over the past few years and it has changed my life. How can I know if it's evidence-based? So at the time, Googling. And then I was like, all right, there's nothing here. Like, there's nothing that actually has a lot of substantial evidence. And this was back in like 2014, 2015. And I was just so upset about it. And then I said, I gotta be the change. I have to be a participant in how we can showcase how biofield and other forms of energy therapy can be researched. So then I went and got a PhD, and the first thing I said to the director of the PhD program was, I'm going to do a dissertation on Reiki. And they all look at me like, I don't even think I know what Reiki is, but we're going to support you. And then it all just kind of came to be since then. Got involved with the Center for Reiki Research and have been a part of that team since about 2016 or 2017. And it just has been a part of my life ever since.
That's amazing.
Yeah. Who would have thought it all started with a patient?
I mean, people who listen to this podcast will probably believe that completely because they'd be like, yeah, that's how it works sometimes. So would you talk to us a little bit about some of the research that you've done? I know that there's an extensive amount. Like let's start would you define what Reiki is for us first? That might be the best place to start. And then would you follow up with some of your favorite or most compelling Reiki research findings?
Yes, and I really think it is important to define Reiki, and it's actually a conversation I've had with my research mentor, because we found that when describing or defining any sort of biofield therapy, it's actually really difficult because there's so much jargon and there's a lot that I think really confuses the public. But how I really found it easiest to be able to define Reiki is just to describe it as a non-invasive healing technique that requires a Reiki practitioner to either put the hands on the body, or if somebody's not really comfortable with touch, right above the body or even at a distance, to just promote a greater sense of well-being. If you really want to even take the word Reiki, it actually can provide a lot of the defining factors just within the name. Rei in the Reiki means universal, and ki means vital life force energy that flows through all living things. So in essence, Reiki is there to be able to help regulate and promote the flow of energy within your body. Sometimes I even like to throw in chakras in there, because whether or not you've been in yoga, maybe you've done some acupuncture, or even some other form of Eastern medicine, I do find that chakras can be something that I think maybe more people are familiar with. And what Reiki can do is just try to help regulate the energy centers or chakras in the body to help just promote well-being. So I guess that's probably how I would best describe it. But I don't know if any of you have anything to add, or if you're even familiar with Reiki.
I love that definition, and I think it's it kind of simplifies it. But what I'm also excited about tonight too is just kind of like you were telling your story about being disappointed with not being able to find research out there. Like there's really, I don't feel like a lot of like talk about what specific research is out there for Reiki. So that's why I'm really excited to hear some stuff from you tonight.
Yeah, to get into some of the research, there's actually been a lot that has been published since. I know that back when I was in, 2014, 2015, there weren't quite as many, but I will say now it is really booming. We are getting so many articles, and I believe on the Center for Reiki Research, we have over 400 articles now.
Mm-hmm.
And those are international and national articles. And we've even separated from high quality to lower quality articles. And I'm really excited to say that there are a lot of high quality evidence-based articles now where we have randomization and blinding in ways where we can really try to isolate Reiki compared to other factors. Because we can say Reiki works, but it's really hard to quantify energy. So I think really in order to quantify it, we had to be really creative. We had to control for touch. We had to control for presence. We had to control for a whole bunch of other factors that I do think really are helpful. And I just think that there are so many ways where we can be able to get creative with how to really say that Reiki works or Reiki doesn't work. But we actually just had a conference last weekend. It's called the International Center. It's called International Reiki Conference now. So we've been trying to come up with a good title. So we've come up with international because we've reached over 20 different countries. And we all come together over Zoom and share Reiki research, and we talk about topics. And at this point, we're really growing, and the research is getting much more rigorous. My own research, so what I did for my dissertation was I investigated the use of distant Reiki on stress and anxiety during the COVID-19 pandemic. There's actually a pretty good story about it.
Yeah, so I read that, and there's a lot of science that kind of went over my head, but I got the gist, so I'm so glad that you're about to talk more about this. Please go ahead.
Yes, I was about to say, I was going to put the disclaimer that the published article has a lot of jargon. And I say that because in the program that I'm in, they're very theoretical and theory-based in terms of their orientation. So I had to write it in that lens of Rogers' The Science of Unitary Human Beings. I will say that most other literature that's published is a lot less wordy, but I will say that it was interesting to be able to offer Reiki at a distance, because that was really something that hasn't been investigated, since most of the literature is hands-on, because that's how we all know of Reiki to be mostly. And even when I asked the general public, how many of you have even heard of distant Reiki? And only like 10 or 15% have ever heard of it. And I was like, wow, okay, so there's a lot of lack of awareness of Reiki in general, and especially distant Reiki. But I did find significant reductions in both stress and anxiety measures, and it was something where I felt really hopeful that whether it be a pandemic or in any sort of virtual way, we can be able to share Reiki's benefits with the world.
That's amazing. How did you find the participants for the study? How does that work?
So how I did recruitment was primarily through a concept called snowball sampling. So I would just tell some people to tell some people to tell some people. And I also posted it over Facebook, and I just had people share it. And during that time, just anybody who was interested, I was open to anyone. I said, if you are a human being and would like to participate, please come on in, as long as you're an adult. And that was really my requirement. So I was able to get my sample pretty quickly. Yeah.
That's so interesting. You know, when I was reading that, I was thinking about, of course, it brings you back to COVID and how stressful that period of time was for so many people. And I was also reading some of the comments that some of the people had made about their experience in the study. And it felt like a lot of the comments were made by people who didn't really have any high expectations and were like very pleasantly surprised with the outcome of their experience. And I thought, oh gosh, what a helpful ally in such a stressful time for you to be able to have an experience like Reiki and help alleviate the stress. It was really interesting. Did you feel the same way that some of the people responded were like, wow, this is like, wow. I didn't expect this.
Yes, and especially at a distance. I think a lot of people were so uncertain with how to even proceed with this. They were like, you're going to be doing what? I don't even know what I signed up for, but you told me it may help with my stress and my anxiety, and I have a lot of it right now. So whatever I would do, I would be happy to try it. And I think what really surprised me the most was everybody's openness and willingness to try something that they've never done before. And I really had to commend a lot of my participants for being vulnerable enough to share a lot of their experiences. And even though I could only capture some of the qualitative quotes, I couldn't capture all of them in an article, but a lot of them really felt that they had this moment of catharsis and a moment of release. And there were even quite a few participants who cried during the session. And I really felt honored to have been a participant in that and helping them in their own bodies to be able to go through a sense of self-healing and really feel witness to that experience.
What does the future of Reiki research look like? What are you guys thinking about, talking about, planning for?
A lot of our talk right now is on large scale or longitudinal trials, because even though Reiki's great now, we don't know if it's great in 6 months. It's like I can offer a session now and you immediately tell me I feel great, or maybe in 7 days you say I still feel great. But we don't know if in 6 months or 1 year or 2 years, like how long, does it take until maybe you need another session, or how many sessions, like the dosing of Reiki or the duration of Reiki. How much is enough, right? And that is something that we are still continuing to investigate, and also controlling for other factors such as, like I said before, touch and presence, since we still are always in need of more randomized and blinded and all these other forms of high rigor methodological design. So we're really moving in more of that direction. I will say what's kind of interesting in that it might appeal to the audience too, is we are starting to look into technological ways to measure energy. Yeah.
Oh, wow. Say more about that.
Have you ever heard of Kirlian photography? Like, I don't
have
know.
not.
I think I have, but I don't know too much about it.
So what it is that it can, I know one because I have a device that can measure, it's a form of Kirlian photography. So what you do is that you would, in this case, put a finger in this box, so to speak, and it will shoot out a small electrical charge. And what it does is that it measures the energy or the amount of joules that's emitting off of your body, and it's able to calculate, in essence, how much energy is going on around your body and your chakras.
Wow.
It's very fascinating. So it's all this cutting edge, latest
That's
work
cool.
with being able to quantify energy, and even more after Reiki, seeing if that changes or if it gets bigger or if it's, yeah.
Great.
That's so interesting.
Yeah.
Oh my God. Okay.
That's pretty exciting. Yeah.
Some other questions we had for you, Jen, in addition to research, was to talk a little bit about society and sort of their acceptance of research, right? So there's definitely the science side, but then there's like the readiness of society to be there to receive Reiki. And so I guess my first question for you would be, like, in your opinion, what is a healthy balance between let's call it an Eastern practice like Reiki and something that's more traditional Western medicine? Like, what does a healthy balance of those two applications look and feel like?
Yeah, that's a really excellent question. And there really must be a true balance between Eastern and Western medicine, especially if we hope to have complementary therapies like Reiki be more adopted in mainstream healthcare. I will say that the nursing profession in particular has really taken Reiki by storm, and really, I think, does a great job with blending both what is, alternative and complementary, because they are always with patients and really always want to be able to offer something to their patients to help promote greater healing. So Reiki in healthcare now really is used more in a complementary fashion, where we are still doing full standard treatment, and yet Reiki is more often used to promote well-being, maybe reduce stress, help with relaxation, pain relief, just in addition to what they are already receiving. And I think that is really where we're going to be able to see a lot of the acceptance coming to be. Because if I were to say, let's offer Reiki instead of giving you an antibiotic for strep throat,
Right.
that's not going to work out well.
Right.
Right.
Because I think there is a place for both.
It's interesting because my sister Abby, who's the reason that we do this podcast, is a cancer survivor and of stage 4 oral cancer. And when she was in the hospital going through that surgery and all of that treatment and care for cancer, one of her nurses, they had a program at the hospital that offered Reiki. And that's the first time she ever experienced it, was when they came in. It was like a complimentary service, I think. And she had Reiki done for the first time. And it was such a notable experience for her that, like, years later, she became a Reiki master herself, right? So I think even when, like, regardless of the healthy balance between Eastern and Western, when someone's exposed to it and then it stays in their mind, they're more likely to bring it back up as part of their overall wellness approach to wellness down the road, right? Like, so they may not keep pursuing it in that moment, but a couple months, couple years down the road, they may revisit Reiki as a way to support their overall healthiness and well-being.
Well,
I'm
it
sure
kind
you
of
probably
goes.
see that too.
It kind of lends to what Jen was saying in the very beginning about how Reiki found her.
Yeah.
It's kind of what happens is like, yeah, you might be exposed a little bit, and then 5 years go by, 10 years go by, and then something lands, and yeah.
Amazing. So, Jen, you were talking earlier about how you were, when you told a lot of your professors or mentors that you wanted to pursue this and research, and they were kind of like, okay, and they were supportive, but they were probably raising an eyebrow at the same time. What has like the evolution of those conversations been for you with people accepting Reiki versus offering resistance to it? Do you find that people are becoming more receptive to it, less receptive to it? What has that journey been like as you interact with people and talk to them about Reiki?
I will say that I think it is becoming more embraced now than maybe even a decade ago. And I think that there's really just more awareness. And although my professors really weren't aware of it or have heard about it, I feel like once they learned about it and really saw my passion in it, they were so accepting of it. And maybe that's one of the benefits to Reiki just generally, is that I find that once it's exposed or around you, I find it's very hard to really feel reluctant to be around it. I will say, though, that of course I've encountered many people in my life who have been like, I don't think this is real. I don't want anything to do with this. Like, it's just not a thing, right? And it's even amazing just thinking and reflecting about how much people's perceptions have changed the moments that it either just has been a part of their life, or even as they allowed me to just let them try it for 5 minutes. And I said, no expectations. I say, you don't have to believe it. All you have to do is just sit in the chair and let me be able to just offer Reiki for 5 minutes. And I said, you don't even have to tell me the truth. Just sit and receive. And it's amazing how many people's eyes opened and then they start talking.
Yeah.
Right? And they say, oh, because this was all when I was working in the ICU. And sometimes I would have time to be able to offer Reiki to the nurses.
Mhm.
And they were all just talking to each other and being like, this is kind of interesting. And I kind of liked it. Like, I felt more relaxed. And then all of a sudden, more people started to sit down and more people started to sit down. And it really created this cascade of curiosity and openness. And then it just became part of our vernacular and our conversation.
It's really touching to hear, because I personally believe that there is a balance, right, between Eastern and Western, right? So, like, if you're in emergency medicine, there are certain applications that you absolutely need traditional Western medicine, right? Like, if you're losing a leg, you don't need Reiki, you need Western medicine, right? But it is nice to hear that healthcare practitioners are thinking about it with that open mindset, and that, I hope that society continues to step into that as well. Question for you. If someone who fervently says they don't believe in Reiki and they receive Reiki, they're willing to receive it even though they don't believe it, does it still work?
Yes, thankfully, it still works. Because energy moves within us and between us, whether we think we can control it or not. It is something where I always say to people that I actually really just hope that you are at least consenting and are open to receiving it in that sort of way, even if you don't necessarily believe that it works, but you have the openness to receive. Because I do think that in some way, you do have psychic energy that can just be like, I'm just not into this, right? And can just completely block it. And I also think that there's a degree of, well, even if I don't believe that it works, something's happening and I'm curious. And I find that's actually where most of my clients, when I had my Reiki business at the time, were kind of at that place. Like, I signed up, I'm willing to pay for it, but I'm really not sure, right? And I always say that's okay. That's the whole point of just being here, letting me be able to offer, even if it is just, I always say, just help you lose an hour of your time. That's it. I say at the end of the day, if that's all that happens to you, that's okay. And just know that energy is smart. It moves within you, within me. And I really am hopeful that it's helpful. And I always set a really good intention whenever I put my hands on anybody, and just hope that they can really receive it. But I think even sometimes they receive it even without being aware that they're receiving it. And I think that really is most profound during end of life. I will say that whenever I do end of life, that's where I find this concept really shines brilliantly.
Wow.
So-
So will you talk more? Sorry, Leo, go ahead.
Yeah, I was just going to say, but I think this is going to lead into it. But I was going to ask you, Jen, do you have like a memorable story about, I mean, you know Reiki works, but do you have a memorable story where Reiki either just really surprised you or it just kind of took it to another level for you and it's like, wow, I knew this was good, but
Yes, actually, and I have not thought about this moment in actually a very long time, and I'm actually really humbled to just think about this again. I'm actually feeling moved. So it was a scenario where I was asked to offer Reiki to a 6-year-old girl who had an open abdominal surgery, and she was in a pediatric ICU in a neighboring hospital. And during that time, I went in and, I mean, she had no idea what Reiki was. She had no idea what was happening to her, but she was in pain and she was frightened and she just had this major surgery. And what I did was I just offered her Reiki for an hour, and the nurses were fantastic. They were trying so hard not to be interruptive and all of that, even though, of course, it's an ICU. I mean, you have to care for your patients when you can. But for the most part, I really had some protected time with her. And during that time, she fell asleep. And her vital signs, I mean, her blood pressure went down and her heart rate went down. And one of her family members told me and said, "This is the first time I've seen her truly relax ever since she came in." And she's like, "This is really beautiful. And I just can't thank you enough for being willing to volunteer your time for me and, for the patient." And I was just, totally moved by that moment because I really could see it with my own eyes. I could see it hemodynamically. I could see it in her affect just because I knew she was in pain. And I really just focused on covering above her abdomen, because obviously you wouldn't want to really touch an open,
right.
an incision,
Sure.
but just above it, because you don't even need to necessarily get all deep in there, but just to work with the energy around her body. And even though she had no idea what it is, I guess you can technically call her a skeptic, because if you don't really believe or really know what's going on, but in some way there's consent, because she knew I was going to touch her and she did consent to that, but I don't think she really understood what was necessarily happening, and that was okay, because I told her that if she was uncomfortable to stop me, and that if she was comfortable to let me continue. And she let me do the whole, and then, like I said, she fell asleep.
Wow.
That's awesome.
Yeah.
Oh my God, that's so beautiful.
Yeah.
Will you talk more about the end of life Reiki? Like what does that look like? What does that exchange between you and the patient look like? What are you thinking about or in service of at that point in time?
Yes, and I can think of a case where I was working as a COVID nurse during the pandemic, and family members weren't allowed in. This was like peak COVID times. And there were a lot of people who unfortunately did pass. And during that time, I was all bound up, and there were a lot of people who were alone. And I said, well, one thing that I could hopefully do as, they're not conscious, at least, physically conscious, was I can at least lay my hands on them and be with them. And I was very fortunate to have very supportive coworkers who would watch my other patient while I would, be with somebody as they passed. And I would really just offer Reiki to them, and I would ask their, energetic beings that if they were accepting to accept, and if not, just to allow me to be present with them. So I would always offer Reiki, and I would notice that their breathing would be less labored. They would even become less restless. And it was a really amazing moment for me to still be a sense of support to my patients, even when they are passing away. And yeah, I really loved that part of my career, to be able to offer them something when I feel like during COVID, they didn't have a lot of support and opportunities, especially at end of life. And I think that is something that I know myself and I think many other nurses really struggled with during that time.
That's really beautiful.
Yeah.
Yeah.
That's outstanding. Are there specialties of Reiki? So when I say specialties, I mean specialties that almost mirror what you see in Western medicine. So a Reiki specialty for maternity or oncology or any application like that you see happening?
That's a good question. I don't think that there's necessarily a specialty, more than I think that there's volunteers who I think are more needed in particular areas. I do find oncology is definitely the biggest place where you will see a Reiki practitioner. And I think because of the just mental and physical components of having cancer. And yeah, there's tons of literature and evidence-based support on its ability to be a facet for nurses to feel empowered to help their patients and for the patient to feel supported by their nurse. There's actually a lot of literature on how it promotes connection, how it helps them with their diagnosis, how it helps them through pain management and chemotherapy, how it helps them with their stress and anxiety. And it really is, I guess, more of a niche area there where I think that there are a lot more, I guess, of a need. There's more of a need in that department. And I also think we're starting to see it more in operating rooms. Have you ever heard of Dr. Oz?
Oh, yeah.
Yes.
Yeah. So he's actually a really famous case where, as a cardiothoracic surgeon, he said he always had a Reiki practitioner in the OR with him who would do
Really?
Reiki at their feet while he did open heart surgery. And he was very much a proponent, saying that his outcomes had greatly improved because of that. And he was a full-on believer that Reiki was beneficial to his patients. And there's just, yeah, I'm starting to see more of an uptick of Reiki being used in ORs now because of that.
That's so interesting. So that comes back to the whole conversation of Western versus Eastern and like what does a healthy balance look like? Like that's a beautiful illustration of what that looks like, right? Traditional medicine versus non-traditional. Yeah. That's amazing. I love that. What would you say to someone who wants to explore Reiki? So let's say they're listening to this right now and they're like, okay, I want to go check this out. Is there any central list they can go check and look for a practitioner? Do they just Google Reiki practitioner? How would you suggest someone get started in exploring Reiki if they have like entry level right from the beginning? Don't know anyone else. How do they find it?
One place to start would be, it's on a website called the International Center for Reiki Training by William Rand. And he is a pioneer right now with Reiki. And a lot of people who are in the Reiki community have heard of him. And I find that he is a really reputable source, along with a lot of his books, I think are also a really great place to start. In addition, the International Center for, I think it's not Reiki Training. There is other
Organization.
lists. Yeah, like there's other organizations that are also a part of the Reiki, and for some reason it's totally escaping me right now. I apologize. Oh,
Okay.
I remember now. Sorry, it's the International Association of Reiki Practitioners. So they
okay.
they're also a really great resource, particularly if you are looking to try to find a Reiki practitioner in your area. So, for example, if you were to go and navigate that website and look for, say, Reiki in Boston, you'll be able to find a list of all of the practitioners who are in Boston and even the neighboring towns and cities. They also have the ability to link you to a practitioner that lives near you. Because all the Reiki practitioner has to do is just to put their information in and where they practice, and then it just allows for greater visibility. So that would be definitely a place to start, or even just like what you said, Erin, just to Google Reiki and wherever you live. And that could also really help identify maybe who would be a good Reiki practitioner for you. But I can't emphasize enough to really go based off of referrals and other people's experiences, because there are, Reiki professionals who I think are really talented, and then there are others who, I think are great and can technically do it, but it's kind of like anything. There's some who have a lot of experience and some that don't or don't practice as much. That doesn't say one is necessarily better than the other, but you really want to find somebody who, really resonates with you, and you really have to feel comfortable with their energy. That is really the biggest and most key thing, is to meet a lot of people, because once you find that person that is right for you, then you're going to really feel the benefits of Reiki even more.
Yeah, it's so interesting that you say that, because so Abby, my sister, was doing my Reiki for a while, and then she wasn't feeling well, and I was like, okay, I need to go find my own practitioner. And I was on that journey, I would say not with any sense of urgency, right? I was just kind of like, okay, this will manifest eventually. And I hopped into a local metaphysical and crystal shop, maybe 15, 20 minutes down the road from me. And I was just like on a whim. It was like a rainy day. There was nothing else to do, And I popped in, and the woman who runs that show is also a psychic medium and a Reiki master. And so I was talking to her about Reiki, and the more I chatted with her, the more I felt comfortable around her. And it was going to be difficult for me to find someone other than my sister, because when your own sister is doing it, like, you don't have to worry about any of that. And I just found her, and she's amazing, right? And then I went and looked at all of her referrals and recommendations. They were outstanding. And so I see her about once a month, and I'm just so grateful that I found that interaction. But a lot of it is like definitely getting the referral, checking your references, but also following your gut and just listening to how you feel with that person, because they're doing so much energetic with you. Like, you have to be already at the onset comfortable with their energy so that it works, it feels good for you. But yeah, it was really good being able to find her. How about you,
That
Leo?
sounds amazing.
I just had a question, Jen. So just thinking about someone who's maybe interested in learning Reiki, but how some people feel like, oh, I don't know, I've never done anything like this before, or can anyone learn Reiki? Like, how would you make someone feel comfortable that even you can do it, kind of thing? Do you know what I mean?
Yeah, and I really say that it all starts with being able to find a Reiki master teacher who really resonates with you. Just like what Erin was saying, like when you're in their energy and it feels comfortable. And then once you really have had a few sessions and you start to feel curious about it, or you're like, there's something here and I really have found benefit for myself, either I want to offer to myself or offer to other people, I really want to become more involved in this, then you really can reach out to either a Reiki master teacher that is working on you, or they may not be, and then you may have to go to somebody else. But ensuring that they do meet the credentials that you're looking for, and then going through the attunement steps, because there are different levels of Reiki. And, there's Reiki level 1 where, it's a really great metaphor to describe it, but my Reiki master who attuned to me said, Reiki level 1's like a straw. It's like, it's good, you can give yourself energy and it feels really awesome, but you're not quite there yet, like in terms of getting its full maximum potential. And then there's Reiki level 2, where you can learn different symbols, you can offer it at a distance, you can, target for different things. And then she's like, it's like a triple straw. So it's a little bit stronger.
Yeah.
And then she's like, then you become a Reiki master, and then it's like a garden hose. You learn, a lot more, and then, you practice a lot more, and then you get stronger. So it's just like working out a muscle, and you just want to be able to keep utilizing Reiki for it to be at its greatest potential. And just know that you don't have to be a master teacher to be able to be a great practitioner. You can be a level 2, and that's actually where most people stop. I would say is level
Yeah.
2.
I tell a lot of my students, anybody that's gone through level 2, Reiki Master isn't for everybody, and there's like so much you can do with level 2.
Yeah, really. I mean, you have symbols, you have different things in your toolbox to be able to use. I agree with you.
Right? You can do the distant Reiki. I mean, that's just a big, huge thing right there.
Yeah, I always tell people at the very least be level 2. I say you don't have to be a master, you definitely don't have to be a master teacher, but you can at least be level 2. And I say that at least allows you to be able to offer to different hospitals. It allows you to be more integrated in the community. Level 1 is really great for yourself, and I would say to your family, some of your friends, and kind of keeping it, like that. And it was interesting because I've had Reiki shares before with a whole bunch of different levels. And I was pleasantly surprised that when there was a Reiki level 1, I still felt a lot of benefit. So I felt like it was kind of like undoing a lot of my perception of like, well, is being a master necessarily better than a level 1? And I felt kind of fooled. I was like, oh, actually, I got a lot of benefit from Reiki level 1, and I'd say even more than this level 2 before. It was very interesting.
Awesome.
Yeah.
So also, Jen, we like to talk about animals on the show. And so I just have a question. So, I mean, I know me personally, I've done like Reiki with my cats and, friends who's like they had a situation with a pet going on and they're like, can you send some distant Reiki? Do you have any animal stories?
I have to talk about Randall. So I have
Okay.
a cat named Randall. All right, so he's a rescue, and I got him from, believe it or not, the East Coast Canine Rescue League, but they
Oh,
also
wow.
rescue cats too. And is he a love? And he ended up getting surgery on his shoulder, and he had his tail amputated because they found him, I think he was in North Carolina during a hurricane, and he ended up getting like huge lacerations from being in a car, like a car engine trying to be warm during that time. And
Oh,
someone
wow.
turned it on and didn't know he was in it, unfortunately. But thankfully, he's okay. And so now I get him, but I can feel like the energy of his shoulder. And he can't really jump well, but I just would offer him Reiki, and I could feel him just relax. And he's just always needing to be close to me. And I would always just offer him Reiki, even just when he's on my lap. And I'm just like, oh, I can just feel like the fact that, he probably has like shoulder issues and pain, but they just can't express it in the same way that we can. We can be like, oh, this muscle hurts or, but instead he'll just come up to me and just sit in my lap. And he would sometimes even lean into my hand and just allow me to just offer to wherever's hurting him. If he sometimes puts his shoulder in my hand, and then I know that he just needs me to just offer him some Reiki at this time, and he certainly loves it. I'll tell you.
They
like
do.
cats, oh, they love it.
That's
Yeah.
awesome.
That's so amazing. My dog is a tripod. He is a result of a car accident. And when we would go down to visit my sister Abby, she would do Reiki on that area where he's missing a leg. And she would say, she would say there's a lot of energy here that needs to clear out. And then at first he was very his first reaction was kind of like, what's happening, And then maybe 2 or 3 minutes into it, he was out like a light, like literally just hardcore snoozing, whole body relaxed, like everything. It was really beautiful to see.
Oh, that sounds beautiful. Oh my gosh, I'm sure he loved it.
Yeah. Yeah, we love to visit Aunt Abby and get our Reiki session.
And I'm sure he's like, oh, thanks so much. I'm going to just come every week now. Tails wagging.
Right?
Yeah, that's so
That's
beautiful that
great.
we can give it to animals too. I love that.
Well,
Jen, is there anything about Reiki that we haven't asked you that we should talk about? Anything that's like in the whole Reiki world that you think is interesting for our audience to know about or think about? Or something you want to leave with them about Reiki?
yeah, I would say to just give Reiki a chance. because I think that even though this podcast, I think tailors to a lot of us who I think are very much, energy people, spiritual people, that I think that there is a lot of confusion, and I think that there's a lot of misconceptions that Reiki is not efficacious, or it's not evidence-based, or it's not, as good as other therapies, but it can be, because Reiki is starting to become more mainstream. It's becoming more a part of our, life now. It's like I'm seeing it a lot more than I've ever seen it. And although Reiki isn't covered by insurance, which I think is really an avenue I wanted to talk about, because I know chiropractic care is actually the most common complementary therapy used, followed quickly by, acupuncture, yoga, meditation. But that's because a lot of those therapies are covered by insurance. And I would hypothesize that if Reiki was covered by insurance, we would see a lot more people wanting to use it and be more aware of it. But unfortunately, it's not there yet. And there's actually a lot of people who don't really want it to be that regulated, just because of the fact that, it would require licensing, and it would be, very difficult at that point for anybody who has a business. So it's currently still considered just like a standard bodywork practice. But I will say that Reiki is still a really beneficial therapy, and I just hope to just have more people talk about it and raise awareness, because I think that there are still a big chunk of people who aren't aware of what Reiki is and its benefits.
I love that. That's amazing. That's such an interesting point about insurance. I hadn't ever thought of it until you brought it up, but it makes so much sense. Yeah. That's awesome. Leo, anything else for Jen?
I think one last thing I wanted to maybe ask was, I know a lot of people that Reiki finds them and you get introduced and you follow that path and that journey with Reiki. It can be really life-changing for a lot of us. Like, can you talk about anything that maybe had Reiki had a really big impact on your life?
I will say it was definitely when I was going through just a lot of my own mental health issues, and I was extremely stressed, extremely anxious, and I felt that I was always taking on too much. And I think I'm just such a creature of habit, where I just feel like I need to work 10 jobs and I need to just always be working. And I got to the point of just significant burnout. And I said to myself, I really just need to pause and I need to stop, but I need permission to stop. So it was really when I was able to get Reiki done and really have this moment of I would call it a catharsis, but I just started just crying. And I just said to myself, you know what? This is really a beautiful practice. And I felt so connected to just another person who was working with me. And I was like, this is really, I think, the moment where I was like, more people need to know about this. People need permission to stop. In America, we're all just so busy.
Right.
We all have full schedules. Reiki is a permission to stop. And it's a permission to offer something to yourself and to give you that grace to say, my wellness, my self-care is important. And I need to cherish that, so then I can continue to move forward and help more people. Because if I don't take care of me, I can't take care of my patients. I can't, be a great friend. I can't be a great family member. You're just so limited at that point. So I just think being able to say Reiki is a part of my daily practice, and I love being able to say I designate time for it every day, because that is something that I can truly offer to me.
That's great. Thank you.
That's amazing. It's not going to get better than that. That's amazing. Thank you, Jen, so much.
Of course.
All right. So, Jen, we talked about a lot of things that I think we'd like to link up to in the show notes. So we'll work with you to make sure that all of the right links are in the show notes so people can follow and click through to a lot of the content that we talked about. Does that sound good?
That sounds great. Yeah, I definitely have some resources like the Center for Reiki Research and also my contact information. You can always contact me by email. I would love to be able to be in contact with anybody who has questions or would like more information or resources. I'd be delighted to be able to be in contact with you.
I love it. Jen, Leo and I love this chat. Thank you so much. Thank you for listening to Mystery of the Soul. Be sure to subscribe so you never miss an episode. If you have a question, topic suggestion, or just want to say hi, we'd love to hear from you. You can visit our website at mysteryofthesoul.com, reach us on Instagram, or email us at mysteryofthesoulpodcast@gmail.com. If you're interested in booking a session with Leo, you can contact us at Mystery of the Soul or visit Leo's website directly at leomediummccarthy.net.